Ray Aldridge, MD. Been here at Colquitt Regional Medical Center since 2001 and practice general otolaryngology, or ENT. Well, born and raised in western Pennsylvania, just outside Pittsburgh, PA. Went to school, Harvard College in Boston, majored in physics, but always had an interest in medicine, so applied, got into medical school, Philadelphia at Drexel, and then did my internship residency in ENT up in Albany, New York. Briefly worked in Thomasville for about a year and then moved to Colquitt here, and have been here ever since. Well, physician, like I say, I've always had some interest in it. I was headed maybe for an engineering career, but the timing wasn't right, and it just, medicine was a better choice back then. So, and I enjoy it. It lets you, ENT especially, you get to work with everybody from a six-day-old person up to a 95-year-old. So that's pretty much how I got it. It wasn't my plan, but I really enjoyed it after I got into it. So, well, I'd like to say the variety is the biggest thing. You're not stuck with one sort of field. You can do anything from, work a pure office practice, do allergy, which we do some of, to pretty intense surgery. Well, what keeps me motivated is, offering procedures to patients that are safe and effective. For example, children, you insert a simple ear drainage tube in and ear infections for a year or two. With adults, we do a lot of sinus work, some of which we can now do in the office. Fairly straightforward, and it works, probably 80–90% of the time. It gives people good relief with a safe procedure. Well, Colquitt Regional Medical Center has a very good staff to work with. The employees all have a good attitude, better than most places I've been at. They seem to be happy to work here. The facility is first rate. We have a brand new operating room with all the equipment, the latest anybody has. So, but it's a fun group of docs to work with.